Good morning, students. A very good morning. So I think we started a fresh session. So we will start with something called sexual disorders. As previously we already discussed, we will discuss something regarding sexual disorders and all the sexual physiology, everything. Okay. After that we will go on with neurocognitive conditions, right? So without making any delay, we will start. Okay. So we will start sexual disorders. Okay, so how does a sexual response cycle moves, or simply how the sexual physiology generally occurs? What are the steps in general? You just remember with the mnemonic DOR, DEOR. Okay, if you ask me what is meant by DOR, means desire. First you will get desire. A desire just generates in your body for other partner, then it leads to excitement. Desire causes increase in excitement leads to plateau phase. Plateau is something I think you know, simply saying first night. Think like first night. So all halka chalka happens. So finally after reaching to the climax thing, you get orgasm. After orgasm, final thing is resolution. That means both boy and girl or man and woman, they become normal. Final means they pack their items and go to their home. First desire, excitement, plateau, that is first night, finally climax, orgasm and resolution. Now one of the most common conditions that a male suffer with, erectile dysfunction, and one more thing is premature ejaculation. Now what is the difference, sir? What is difference between erectile dysfunction and premature ejaculation? I will just explain you in a simple manner. See, erectile dysfunction is something which occurs in the excitement phase. It occurs in the excitement phase, means the penis itself does not erect. The penis itself does not erects straightly, firmly, strongly. Even though there is a exciting factor, that will, let it be wife or girlfriend or whatever it is, nice woman, beautiful woman, but still the male or the man does not get excited, or even though he is excited, his penis does not get erect. So that is called erectile dysfunction. But what is premature ejaculation? The penis gets erected, but as soon as he introduces the penis into the vagina or something called intercourse, as soon as he started the intercourse, the ejaculation occurs. Within not even less than something like within 3 seconds or 2 seconds only, the ejaculation occurs. So that is called premature ejaculation. So premature ejaculation occurs in orgasmic phase, right? Now what is the treatment for erectile dysfunction? One of the most famous class of drugs that we use is PDE5 inhibitors. Can you tell me some of the examples of these PDE5 inhibitors? Tadalafil, then vardenafil, then sildenafil. Guys, I want to ask you, can you tell me one side effect or contraindication for PDE5, in which individuals or in which patients you should not use? In heart patients mainly. Heart patients mainly who suffer with hypotensive conditions. Patients who suffer with hypotensive conditions, in those patients these are contraindicated. Why? Because these are all vasodilators. How they act is, they inhibit PDE5, phosphodiesterase 5 inhibitors. They inhibit that one, leading to what happen is the corpus cavernosa, the vascular thing of the penis which is present in the penis, this corpus cavernosa, they get filled with the blood. All the smooth vessels, all the vessels, they get filled with blood, thereby leading to erection. Okay, so these are the things that are given. Now also we give PDE analog. We also give PDE analog. What is that PDE analog? That is alprostadil. Right. So these are all drugs that are given for erectile dysfunction. But if you ask me what are the drugs given for premature ejaculation, something called SSRI, selective serotonin reuptake inhibitors. Okay, what they do is they simply delay ejaculation. They simply delay the ejaculation. But what are those drugs? Can anyone tell? Paroxetine. And another one is dapaxetine. Paroxetine and dapaxetine. And one more procedures that you can follow in order to prevent the premature ejaculation is, you can remember it with 3 S's. What are those procedures? Squeeze technique. I think we no need to explain this technique. It's just a general technique. You just remember the name squeeze technique. Okay, squeeze techniques, also called Masters and Johnson's. Johnson technique. Okay, that is 1S. Remember. Another S is start stop technique. You just start the intercourse, then you go on having the physical activity. At the time while you are about to ejaculate, you just stop it. Stop the thing which you are doing with the woman. Then again, after you feel like the so-called semen which is about to ejaculate just got back, then you again start the activity. Another one is sensate focusing. Another S is sensate focusing. I think you don't need to debrief these things. You just remember the 3 S's. That's it. Okay. So next, coming to the next topic, some of the sexual psychiatric disorders, also called sexual paraphilias, some abnormal sexual behaviors of the people, right? Here we will write the disorder name, and here we will write the what is the features that we see in the disorder. Okay, the first two disorder is fetishism. What is fetishism? Fetishism is, it is the sexual arousal by touching inanimate objects. Inanimate objects means objects which doesn't move. That means simply non-living objects. For example, see, I am not telling it in a negative way, but for example, a boy and a girl are in mad love. The objects which are used by the girl, for example, let it be top or chunni or salwar or chudidar, whatever it is. If that so-called objects, for example, if that girl is moving side by side with the boy, or they are having a general walk at the beach, if this chunni or salwar or this chudidar, if it touches that boy, the boy gets some sort of sexual excitement or sensation. Now that can be remembered as fetishism. But remember, see, I am not saying like that. I am not saying that real love between a boy and girl is fetishism. No, I am not saying like that. I am just taking it as an example, but not really that. Okay, it can be a pure love maybe. But see, love is nothing but science. Okay, it's as simple as like that. Love is nothing but science. I think in the previous, just 1 minute. So in the previous Previous topic I already explained what is the sexual physiology. DEOR, desire, excitement, orgasm, desired, excitement, plateau, orgasm, and final one is resolution. So obviously in the love what happens is, obviously they get married, they have sex, they go for first night, after completion of children they come to resolution. At most they will come back to so called responsibilities only. So love is something that it is just used to bond two persons, right, two unknown persons, that's it, nothing much. Okay, so then we'll go to next topic, that is Frotteurism. Next disorder is Frotteurism. What is Frotteurism? Frotteurism is touching or rubbing one's genitalia to non-consenting individuals. Is Frotteurism done by males or females? Frotteurism is done by both males and females. Yes, both will do it. Not only males, females also do Frotteurism, right? They also have Frotteurism. Next, exhibitionism. If your girlfriend wants to attract you, or if your girlfriend wants to obtain a new phone from you, or if she wants to, or if your wife, don't take girlfriend, maybe some girls in this chat may they feel like negatively, so let us take like wife. If a wife wants to make her husband buy some gold to her, buy some gold bangles, she wants to make her husband to buy some gold bangles, then she will do something called exhibitionism. That means expose oneself or undress. She simply do exhibitionism in order to obtain good nice gold bangles from her husband. Voyeurism. Voyeurism means simply peeping Tom. All Tollywood movies or all Hollywood movies, every movie shows this peeping Tom. See, remember, it is diagnosed only after 18 years. Remember, don't think otherwise. It is diagnosed only after 18 years of age. Okay, that we remember about voyeurism. Pedophilia. Pedophilia means sexual activity with prepubescent children. See, this is the actual term. Most of the people simply say like sexual activity with children. No, sexual activity with prepubescent means who did not reach the puberty. Okay, so sexual activity with prepubescent children is called pedophilia. Transvestic fetishism. These all come in forensic also. Cross-dressing for sexual arousal. Generally it is seen in females. Cross-dressing. Generally females, they used to wear their husband's shirt while the husband is not around. For example, when the husband is in camp, or when the husband goes to some tour on a business work, while remembering him, she just simply wears his shirt. Okay, just remember like that. I am not saying that it is called transvestic fetishism, but just remember, the wife will simply wear the shirt of the husband and feel like her husband is in her hug, in her love. So that is called transvestic fetishism, cross-dressing for sexual arousal. Nymphomaniac. I can't say this with an example, but just understand it. It is increased sexual desire in females. That is called nymphomaniac. Now, satyriasis. Satyriasis. What is satyriasis? Same like increased sexual desire in males. Okay, increased sexual desire in males is called satyriasis. Increased sexual desire in females is called nymphomania. So these all things, all the definitions are very important. It is a INICT as well as equal weightage with Neet PG also. Okay, both have equal weightage for it. Okay, now now someone asked me, sir, cross dressing in gender dysphoria and gender incongruence, what about that? Someone asked me, sir, cross dressing in gender dysphoria or gender incongruence, what about this condition, sir? See, if you ask me about this condition, these things are generally done by the people who are suffering with this disorder only to align or to represent with the gender, only to represent with the gender only. For example, is it a male or female, to align or to represent with the gender they identify with. For example, male identifying like female and female identifying like male. But remember this point, very important, these are done not for sexual arousal. That means these are not like transvestic fetishism, that is completely different. These are not done for sexual arousal. Remember, very important point, most of the people confuse here. Okay, very important point. Okay, now there are actually some culture bound syndromes, means they are not scientifically okay like, but they are culture bound syndromes. I will just tell the names, you just listen. First one is Dart syndrome, something called Dart syndrome. What Dart syndrome means it is the preoccupation with semen discharge, means the male think like there is some semen discharge occurring at the penis, that is called Dart syndrome. And another one is Coro syndrome. What is Coro syndrome? The males think like they have a shrinking or disappearing penis, their penis is shrinking or disappearing. Okay na, shrinking or disappearing penis. So that is called Coro syndrome, this is called Dart syndrome. Okay, now that is all about sexual disorders. Now coming to very important topic and very serious topic, neurocognitive disorders. Very important guys, please pay attention, very important. Okay, I am expecting at least one MCQ in Neet PG as well as 2 MCQs in INICT. Okay, so kindly focus your brains here. So what is the old name of, there is an old name for this neurocognitive disorders, most of the people don't define it, it is called organic mental illness. Now if you ask me what is the most, it is the most common type of hallucinations in neurocognitive disorder. What is the most common type of hallucinations in neurocognitive disorder? Can anyone tell what is the answer? It is visual hallucinations. Okay, it's the visual hallucinations. Now the first neurocognitive condition is delirium. Delirium. Okay, It is the most common type of, I will just write shortcut, neurocognitive disorder. Kindly please, because I am fed up writing the whole form. So it is the most common type of neurocognitive disorder. Now what are the features of delirium? What are the features of delirium? You just remember with a mnemonic, that is A, yes, A3, S3. What are 3 A's? What are 3 A's? First A is acute. What is meant by acute here? Emergency. Second A is altered sensorium. Third A is autonomic dysfunction. Now S is sleep reversal. Another S is sundowning. Another S is slowing of waves in EEG. EEG, or you can also determine it like generalized slow. So these all are the features of delirium. Acute, that is emergency, altered sensorium, autonomic dysfunction, sleep reversal. This is sleep reversal, sundowning, and slowing of waves in EEG, or generalized sleeping like state. Right. Now coming to the next thing, we actually do something called mini mental state examination, MMSG, that is mini mental state examination, state examination for delirium and dementia. Remember this statement, very important. Now if you ask me, if there is less than or equal to 24 out of 30 in this MMSC, right? If there is less than or equal to 24 out of 30, then there is significant brain dysfunction. Okay, now coming to the dementia. What about dementia? It is the major neurocognitive disorder in which activities of daily living are impaired. Simply remember like this. Okay, activities of daily living are impaired. It is one of the major neurocognitive disorder. It is actually, you look like it's a chronic, and one more thing is it's degenerative. Remember, it is degenerative and progressive disorder also. It's also a progressive disorder. Now what you will do for diagnosis? If you want to diagnosis, symptoms should be like, symptoms remain for more than equal to 6 months. Okay, now we will discuss about one more very important condition, that is everyone is waiting for this, Alzheimer's disease. Alzheimer's disease. It is actually a cortical type of dementia. dementia. Now, if you ask me, sir, which part of the brain are mainly affected? Those of temporoparietal parts of brain are affected. Now, if you ask me what deficits are commonly seen, they are actually visuospatial deficits are commonly seen. Deficits are commonly seen. Now, in which sex, which gender most commonly it is seen? Males. Always remember, males are highly affected with Alzheimer's rather than females. Remember this. Sorry. I told in reverse. Not males. Sorry. Females are affected. Why? Because I will tell a simple way to remember. Females keep all things in their mind. All unnecessary things they remember. So ultimately, the females will slowly forget the things, obviously. So females are affected more commonly than males in Alzheimer's condition. Now we will discuss some risk factors of Alzheimer's. What are some risk factors for Alzheimer's disease? It's very hectic. Okay. One of the most common risk factor is age which is less than equal to, if the age is less than equal to 65 years, and if the person has diabetes, the person is suffering with diabetes, and also if they are lower educational status, if they have lower educational status, and also if they are suffering with some congenital conditions like Down syndrome. Yes, Down syndrome, right? Now, for example, one more common things are hypertension, dyslipidemia. See, these all are risk factors for Alzheimer's. See, Alzheimer's particularly, it doesn't point out to a particular risk factor, but you have so many risk factors. Actually, I will note down only some things, but actually you have multiple risk factors. Nearly you can take 100 risk factors for Alzheimer's disease. These all are just an iceberg only. Presenilin, this is presenilin. Wait, I will just write it down neatly. This is very important. Okay, you write this, very important. Presenilin. Presenilin 1 and 2. Presenilin 1 and 2. That's called familial autosomal dominant Alzheimer's, seen most commonly in more than equal to 50 years of age people. Okay. Now, what are the things that we most commonly see, or what is the some of the pathological things that most commonly occur in Alzheimer's disease? There is actually low acetylcholine levels in the nucleus of, which nucleus? In nucleus of Maynard and nucleus basalis. I want to underline this. Decreased acetylcholine levels in nucleus of Maynard and nucleus of basalis. Okay. And one more thing is, there is an extracellular accumulation of what? Very important. There is an extracellular accumulation of beta amyloids, right? And there is also an intracellular accumulation. See, this is an Inicet question, Inicet MCQ. What is the intracellular accumulation that occurs in Alzheimer's disease? So they give 4 different options. What is the intracellular deposition that occurs? That is phosphorylated tau proteins, PTP, also called phosphorylated tau proteins. Okay, phosphorylated tau proteins. Now coming to the management of Alzheimer's, guys, I want to share one personal memory of me as I was discussing about Alzheimer's. No, see, I was writing since the past 3-4 hours, so I just want to take 1 minute of break. Okay. Oh, you're thinking like I'm discussing only this topic. No. Since the past 2-3 hours, I am writing so many topics. Okay. So I just want to take a 1 minute refreshment. So we'll discuss some personal memories. Okay. So see, college life is something which is very funny. So why I am getting suddenly this college memories concept? Because as I was discussing Alzheimer's, I think it was discussed in my second year pathology. This Alzheimer's discussion came. So those days, those college days were really beautiful, astounding. Even today, after spending my college days and after coming out of the college, after years of gap, I remember the college days. Really, it brings tears in my eyes. That's for sure. Really, because friends, foes, enemies, everything, love, then girlfriends, whatnot, hostel life, booze, going out, party, and all sort of all sort of naughtiness we do in wards in the classrooms, everything. The second year was astounding, trust me. Second year was astounding, and even first year is also a nice thing. And again, in which year I think in the final year I enjoyed a lot. Trust me, I enjoyed a lot. See, I can say one thing wholeheartedly. My college life is one hell of a beautiful memory. Really. Maybe I did not work hard, I did not study that much, but still as a human being, I have good memories, which I can say, like, even after becoming old, if I become something like 60 years or 70 years, I can happily say that in my life, I have really enjoyed my life. I did not waste my life for unnecessary things. See, you can fight for good ranks, but not at the cost of your life. You can work hard, but doesn't mean you should leave your college life. No, that is wrong. Most of the people think like that. You should enjoy your college life also, because see, yes, you should study, you should make use of all these things, but one more thing is, if money goes, okay, you can earn it again. That's not a big problem. Even your properties you get down, but still you can earn your properties also. Everything can be come back, but time, your past, that is memories, school, college, everything, you can't bring it back. Never, I say never. The school which I have left, the annual day, the fed day, all the girls, boys having jokes, and while we are having some, I think it was annual day, I just prepared for a dance. And the annual day, the program started by evening 4 o'clock, and my dance came at about a time like 9:25. By the time half of the crowd left the ground, only half or 1/4 of the crowd was left, and everyone was going there and there, here, eating, and I was just waiting for my turn for my dance. In the meanwhile, my friends are coming, cherishing and having jokes regarding our dance, everything. See, school, college is really it's one hell of a beautiful thing in our life. Trust me. Really, I enjoyed it a lot. I have so many memories, and really it makes my life complete. So sorry if I wasted 2 minutes of your time, but still we will come back to the topic. I think all of you have that type of similar school memories and college memories. Come on, man. See, When you get time, you just go to school or college and just you masticate those old memories once again. You just masticate it. You just go on, chew it until you feel like tears are coming from your eyes, because once you get out of that school or college, you can never get back. That is what one of the magic. You say it a curse, you say it a magic, you say it a gift of life. Once the time finishes, you can't go back. It is a linear thing. It is not a reversible phenomena. Okay, it is a linear thing. The time just goes in a one way direction. It will not return. Okay, so try to enjoy your life. Okay, and don't make all mess. Don't just make your life something like complicated, unnecessary things. Don't do all those things. Just make your life as simple as it is and just have fun in your life. Okay, and now coming to the management of Alzheimer's. So I think we previously discussed one of the most pathological feature that we observe in Alzheimer's is there is decreased acetylcholine levels. Now we'll just discuss something. Yes, it's related to the management, but how does the acetylcholine gets metabolized, or which component degrades the acetylcholine? There's something called acetylcholinesterase. Now, what is deficit in Alzheimer's disease? Acetylcholine. So if we increase the acetylcholine, can we say that we can make the Alzheimer's condition a better? We cannot cure the disease, but we can make the condition better at least. So how we can increase the acetylcholine? By decreasing the activity of acetylcholinesterase. The acetylcholine will not get metabolized and it stays for a long time. So we can increase the level of acetylcholine. So now with this concept, we will tell what is the management of acetylcholine. Acetylcholinesterase inhibitors. What are the acetylcholinesterase inhibitors? First one is galantamine. See, this is not only important in psychiatry, it is also important in medicine, it is also important in pharmacology also. Galantamine, rivastigmine, donepezil. Sorry guys if I have made you cry because remembering all those past school days and college days. See, there is no need to cry or feel like that. See, time should go on. Time will not wait for anyone. Okay. So NMDA antagonist. NMDA antagonist. What is meant by NMDA? Can anyone say? It is N-methyl D-aspartate. What are NMDA antagonists? Memantine. Very important drug, and it is not Neet PG. I think INICET favorite. This memantine drug is. Okay. NMDA antagonists are INICET favorites. So monoclonal antibodies, that is MABs. Why I am writing all these full forms? These two are very important. Aducanumab. See, aducanumab. Another one is lecanemab. Lecanemab. Okay. Now, what these two drugs will do? They simply remove amyloid deposits. They simply remove amyloid deposits. Okay. Now, so with this we finish the management of Alzheimer's also. Okay. All the three drugs of acetylcholinesterase inhibitors and NMDA antagonist, that is memantine, and monoclonal antibodies, that is aducanumab and lecanemab. Okay, these two monoclonal antibodies, they help in removing amyloid deposits. That's it. Now coming to the next condition, that is frontotemporal dementia. Frontotemporal dementia, or you can also call Pick's disease. Pick's disease. Okay, so which part or which segments of brain are affected? Frontal and temporal are affected. Now if you ask me what are the symptoms that we see when frontal lobe is affected, so the frontal lobe symptoms that we see are, first one is echolalia. Second one is echopraxia. Third one is perseveration. Fourth one is personality changes. Fifth one is social incontinence. Okay, so these are the frontal lobe symptoms that we see if the frontal lobe is affected in Pick's disease, or also called frontotemporal dementia. Echolalia, echopraxia, perseveration, personality changes, and social incontinence. You got it right? Okay. Now we will get to one more condition called Lewy body dementia. Okay, what is the causative thing? It is caused due to intracellular accumulation of alpha synuclein. Actually there is a fluctuating course of symptoms. Now you can obviously observe there is a prominent visual hallucinations. Now these patients are extreme sensitivity to antipsychotics. These patients are extremely sensitive to antipsychotics, right? So this is all about Lewy body dementia. Remember, extreme sensitivity to antipsychotics, this statement is important. And you can also see the patient's experience with prominent visual hallucinations. This is also important. And there is an accumulation of alpha synuclein in Lewy body dementia. This is an MCQ. Okay. Next, something we will discuss about Huntington's chorea. Very important, not only in psychiatry, in rest of the 2-3 subjects also this Huntington's chorea is a important topic, mainly for ionized CET. Remember, okay. It is actually autosomal dominant. First point to remember, because it's simple. Some of the things, this autosomal, allosomal, some of the things should be remembered, because there are high chances that they might come as a MCQ. These are actually CAG trinucleotide repeats. Occurrence of CAG trinucleotide repeats is seen. Most commonly chromosome 4 is affected. And one more thing is the GABAergic neurons are affected in the caudate nucleus. Remember this statement, very important. Okay, caudate nucleus. Now some of the things which most of the doctors they don't explain, they are actually seen in the 4th decade, right? It might look like simple, but why I am still explaining, why I am still saying this statement that much deliberately is because in the question you might get like a patient of age 49 years, a patient of age 44 years, a patient of age 46 years, a patient of age 38 years. So if you know in what decade of life the patient is, in the third decade or fourth decade or fifth decade, some of the diseases are exclusively, for example, you take Alzheimer's, it's exclusively seen in seventh decade or sixth decade of life. So if the patient is of 66 years, most commonly it can be Alzheimer's only. Okay, so it's seen in fourth decade, and dementia is also observed in the patient. Dementia is seen. Okay, you got it, everyone? So this is all about some of the neurocognitive conditions, and I think we'll start with one more fresh session, the next part. Okay, thank you, your wise doctor.